Welcome to this Improvement Science Snapshot on how to identify barriers to improving clinical practice. My name is Andrea and I work on the Improvement Science theme of the Yorkshire and Humber Applied Research Collaboration. Identifying barriers is important at the start of any quality improvement project, as it should influence the design of your subsequent improvement strategy. Therefore, it's important to do so as robustly as possible. Identifying barriers and facilitators to changing clinical practice enables you to develop an improvement strategy tailored to these and sensitive to the local context. Consensus is that it is advantageous to use theory to guide this process. Without theory, there is a tendency to assume that lack of change is due to lack of knowledge or skills, overlooking other issues. It is also often easier for people to cite barriers like lack of time more readily than less tangible things like organisational culture, so using theory prompts exploration of these less readily thought of influences. Nonetheless, choosing a theory can be difficult. In 2017, Nielsen et al. Published the diagram we see on this slide. It provides a way to understand the different theoretical approaches used in improvement projects. As you can see, some approaches use theory to describe or guide the process. Others to understand what factors influence implementation success, and others to help guide evaluation. In focusing on barriers and facilitators, this session provides an example of a determinant framework. An example is provided on the next slide. Here we see the theoretical domains framework. The authors identified a total of 128 constructs from 33 psychological theories and distilled them into the 14 domains we see here, with definitions also available. The rationale was to make psychological theory more accessible. The focus is arguably more on individual level influences, highlighted in yellow, although social and organisational level ones are also covered. Accessible guides for how to use the TDF to identify and code barriers are provided in the further reading list. Other determinant frameworks and indeed classic and implementation theories will cover at least some of these factors, but may have a different focus or emphasis. Regardless of the theory that you choose, how are you going to gather that information regarding barriers and facilitators? The typical approaches are listed here. Each has important considerations, particularly if you have a limited budget or tight timeline. For example, literature reviews avoid delays with recruitment, but will you be able to truly capture the local context this way? Interviews and focus groups generate much richer insights, but how easy will recruitment, data collection and analysis be? And can you identify the best people to speak with who have the most helpful insight? Deciding is actually very important. If the exploration of barriers and facilitators is not thorough enough, or if you are unable to distill the most important issues, you may overlook key influences and then fail to target them with your tailored improvement strategy. An example is provided on the next slide. Here is a summary of the barriers and facilitators that I identified at a mental health trust as influencing nurses' performance of nationally recommended physical healthcare checks for service users and the barriers and facilitators influencing service users' attendance at these checks. They were actually identified using a literature review and were later coded using the theoretical domains framework. However, to check the fit with the local context, they were then shared with staff and service users. Critically, this uncovered additional factors. A really important one was a lack of calibrated weighing scales on wards, something likely to be pertinent and easy to address, but only uncovered when the summary was shared with key stakeholders. The robustness of your barrier identification work may be strengthened through using a mix of methods or simply seeking feedback, as I did. By way of a quick recap, the key points covered have been the importance of identifying barriers and facilitators influencing change efforts, as these give insights into the local context. The importance of identifying these systematically, otherwise improvement strategies may focus on the wrong things. That theory can help us to think about the range of issues rather than those most readily thought of. That it is important to consider the time and resources you have available and pick your method to suit. And do not assume that you know what the barriers are. You may well be wrong. Thank you for viewing this Improvement Science Snapshot.